everybody. This is Catherine from Ming Acupuncture, and thank you so much for joining us. We have successfully finished 3 times, and this is our last time of our workshop. But of course, we will have more. We will talk about that later. From next week, we'll have more workshops. And today please let me open the. Yeah, we can start now. Yeah, that's well conducted.
No, because we are a little bit, today I want to put a little bit herb or something. Catherine said, like it's the last time. I'm talking about, for the COVID time, okay? Let's say COVID time, since we cannot come to the office and our office is now open. And another reason is because according to the guideline, herb won't be able to use as a treatment. Okay, that's why our office try to use the best way to say what we can do for all our patients when you are home to quarantine, and then we can still do something, at home with the food, with the essential oil, with the massage, acupressure. But herb, in America, we won't be able to say we can treat it. But we still use some, let's say ginger is the herb or not. But we will say it's the herb, but it's a food also. That's why we choose something can use for the food, but work as a healing process, let's say this way. So it's very tricky. And then for safety, we want all patients will know, we claim that herb cannot be treated, but for our responsibility and for our knowledge, we want the patient to know what kind of things can use in this special time. That's why we use the 4 times for COVID. Okay, only for COVID use time, special time for use for the all acupressure point, and then for our herb, the food, essential oil. And today we're talking about some recipe and then some cooking way. So we try to use the way it's allowed us to tell patients which is work at home. Okay, of course, cooking have so many different dishes. Why we choose that? It's because we know specific way to use them can work for some symptom. That's why. Okay, we said, oh, this is 4 times. We try to gathering together 2 times a week. And then this is the part we try to say, just as like that's it for now. And since our office won't be able to open until the mayor or whatever, the Cuomo said, oh, now we can start, okay, run the all office, everything, because they have a guide to say first stage and then which one can work, and second stage, which one. The medical necessity, it's like a office can be used for second way, as I know, as I understand. So we are working very hard to try to make an office can be open during this time. Okay, so we don't know how long it will be, but we try to use the topic, which is pain management, which Dr. Fang will start, and I will do the like women's health care. I will do the puberty, and I will do the menopause for the first time. And then every 2 weeks, we use the topic way, and then at least we will give some information, and then like we do before, we use the topic to say, oh, pain management. So what we can do help yourself for shoulder, the neck. Dr. Fang, she actually, her father is a very famous doctor in China. Have a electric, you know, point, like he studied for special for the electric machine, like you can use by yourself, and then you can either use some pressure point or the like a stimulation point, and that's why I want to, she can do it. We are trying to let her father can be Professor Fang. We see if we can, okay, let her get on the, because he's very famous in China. Also, he's very good to give the information, and very good in English too. He get the all study in Japan and then America also. So that's why we want you will get the chance to, you know, another time you want to Professor Fang, it's difficult. But this time I want them, I said, please, maybe you can do something. Maybe several simple way to tell patient what to do, okay? So I hope that all patients will be appreciated, okay? But we're still working on it. I don't know if he can do it or not. We're still try to work on it, because China, it's hard to, I don't know the Zoom if it's work or not, but we're trying very hard to work on it, okay? And then after that, because now, and then I want to, because in our office, you know, women's healthcare is a big issue. Puberty and then the menopause is one part. It's a hormone, either too much or too low. And then after that, I will use the pregnancy and like a post-labor, something like that. So it's my work, and then Dr. Ling will work for the different, and we're trying to get the more information gathering together. Even you are home, still can get some help. That's what we want, okay? So, if our office not open, please notice, and our staff always here try to help you as much as we can do. That's I want all you can know, because you stay with me for so long. How many years? 30 years. This office, the oldest patient, we are on all the 30 years already. So it's a friend. That's why it's not like only the patient. It's really, you know, if you are here, I really think you are a friend. You always be with us. I'm so appreciate, our all staff appreciate, okay? So just to know we're always there. Doesn't matter the office open or not, okay? But we're always with you, okay? If we can do something, okay? So today we will still continuing for our recipe first, and then I will give you some information about the simple like herb remedy, and then we can do at home, okay? So this is, we will start from today. Okay, last time we're talking about the basic like tea. Actually, if you said the lemon or radish or ginger or onion, everything, you can use it as a tea. Also, you can cook with the food. Why we sometimes say, oh, you can make it a tea, or sometimes we say you cook with the food. Besides the tea, we want to, you know, the daily tea, we want to really feel good taste. Like I make that 1 cup of tea, I relax, I drink it. If I'm not sick, I want this tea taste good, okay? But if someone is really sick, of course I give something it's necessary to use for healing process. So sometimes that tea not taste good. But when we're talking about the regular tea, if for prevention, mostly they're good. Taste is not too bad. For example, like we discussed about ginger, and then the ginseng tea, the ginger tea, the orange skin tea, or lemon tea, the taste should be good, okay? Sometimes the smell, people like my daughter, she never liked the ginger tea. I love it. I love the ginger, but she doesn't. But sometimes the tastes are very different, or you like sometimes the flavor, okay, flavor-wise. But basically, they are good. Today, we're talking about we use this one to cook. First of all, we choose they are really work in this special COVID season. For example, they can clear away the mucus and then open the chest for the breathing, okay? And then they should be very good for the protein. But sometimes when you say talking about the protein, some protein sometimes is not good for you. For example, shellfish have very good protein, but we're not to suggest you to use that because they may cause the more cough or the asthma or trigger your allergy. That's why we don't want to recommend you, okay? So in this time, which we're talking about, we want to bring you good nutrition or give you like a treatment or healing effective. Okay, this is because they really work for your lung, for your immune system, for your recovery, for your energy, okay? That's why. That's what we choose, okay? I would like you to take a look at this one first. For example, ginseng, do you know that? They are the most important the herbs to bring the energy for the patient. But when I work for the patient, this is in the COVID, very early beginning, when they get very, very heavy breathing issue, like a mucus or something, I cannot give it to them because you have very thick mucus. Or sometimes when the patient is very dangerous, what's going on? Okay. So ginseng, the first time we were talking about have 3 kinds, and then we have to choose, okay, which kind which we can use now. For the recovery season now, we're talking about like American ginseng is good, okay? But today I have one patient still is on the very slow, like the COVID recovery. Her oxygen is not good, and it's very cold, and then no energy, always feel cold, and then feet and the arm and the heat, it's so cold. So we used like a Korean ginseng. But Korean ginseng, you need a prescription. Like I think I have to let the doctor take a look. And we can make a ginseng cook with the chicken and then like a little bit meat also. Okay, we can do that. And then this is like a pearl barley. The pearl barley, it's very good for take away the water retention. So now we use a lot, cook with the green bean, okay, the green bean. So it's very good, like when the patient have a puffiness, okay, water retention, lymphatic drain are good, and then you can use that to cook. The date we use for the patient, like older people, this time senior after COVID, sometimes they just don't have any appetite. We use a little bit date, cook with the barley together, and then help them recover, okay? And then the lily, we help them, like the patient always complain, say, I'm so thirsty, I drink a lot of water, but doesn't work. No matter how much water I drink, but I still feel my skin is so like a crack, and my tongue is cracked, my lip is cracked, something like that. And then we use a lily and cook with the like American ginseng, okay? And then This lotus seeds also is very good. Okay, it's a cook with the date, and then can help with the appetite for older people if their appetite is not good. Okay, or some people today also I have one patient, just is from another doctor recommend me. She just had a baby. I think it's the first week after labor, because there was very stressful. He's in the like a hospital for delivery, but she heard someone sick in this like hospital. She feels like every day she feels like, oh, I maybe got the COVID. That's why she cannot sleep. She have no appetite and I cannot eat anything. So today I recommend also cook with that, also very good. Okay, and I add some like orange peels. And this one cook, if you cook with the chicken, and then it can help your mucus. Okay, and the yam you can cook with the chicken also, and then you can. They will be very good for the patient, like menopause, hot fresh. It's very good. Special, like you can cook with some. I don't know if you know this is we call the black bone chicken. It's a chicken. It looks like a black. They cook with the yam. Also, it's very good for puberty. Very good for our like menopause patient too. Okay, and then the snow fungus, and they cook with the lily, special for lung deficiency. Okay, this too, lung deficiency. Maybe you can add some. Maybe you can add some like American ginseng. They are cooked, just cook as a tea, cook as like a soup. Okay, if anyone you want some dose or how to cook, and if you want this information, we can give it to you. But they are not very difficult. We just give you the dose. For example, like every day, how much you cooked, and then you can eat it. I know your guy give me the information, say, Dr. Ching, I make the 3 dishes in the same day. So I cannot eat, I cannot finish. I push my husband to eat them. I said, okay. Do every day, little by little. You don't need to cook like 3 dishes in the same day. They don't, you cannot eat too much, right? But we can do every day. We try a little bit. Can help the kids also. Okay, parsley. When you have a little bit feverish, okay, when you have a little bit cold, sneezing, like this season, started the allergy. So whatever you eat, the soup, for when you finish the cook, you chop a little bit of parsley, and then you put it in, and then take it out, and then eat it. Even the parsley, only the root part, boiling with the water. You see, if you have a sneezing, sore throat, it will go away very fast. Try it if you have the issue. Okay, so this is a Chinese, we call the Sichuan pepper. Sichuan pepper. We use a lot for the people like a young deficiency, like have no young energy stomach, feel always gassy and acid reflux, and have a problem with the arm and the feet get cold. So today, you may, why I say that, because today's cook, you will see, they will use maybe one of them. So I put them first, and then you will know, oh, why they put this. Okay. Sometimes it's for taste. Okay, for taste. I want to say this is all very mild. You can put no problem. Only Sichuan pepper. This one, if you have a stomach ulcer, if you have a stomach like a digestion issue, like a diarrhea or something, maybe you are not using them too much. You can't. You will see our cook recipe today. They put several when you make the soup. that's okay, very light. But don't use very, very strong. Because the Sichuan menu, they use them very strong, red. Maybe it's not good for our patient. They have a very weak, delicate stomach, okay? So that's, we put a little bit information in the beginning, and then we start recommend a little bit like the menu for the food. Okay, this is what we talk about the radish, okay? We talk about radish a lot. I don't know, American maybe not to eat this kind of radish a lot. You may eat the red skin one, right? Red skin and the inside white, right? If you cannot buy this one, you can use that, but this one's particularly for the lung function, this white radish is good. I check with the Amazon and I check with the Whole Food. They have something you can order, but I know this time it's a little bit difficult to order because they cannot send it to your home. So you can, I don't know what to do, but we can usually, at least we will know that will work. If you can't, you just get the red skin one, okay? But this one is not beets. Beets is a different function, okay? Beets is different. Look sometimes difficult. It's similar like the red skin radish, okay? But the function differently, okay? This one is very good for if you have a mucus, take away the mucus, okay? And then help with the cough, and then open the chest, okay? And then cook with the ginger, and then they will really move away the mucus, especially when the mucus always like a sticky there. And then this one, when you take it, it will open it, okay? When you open it. In herb, like a recipe, sometimes I will give you the radish seeds. When some patients have a like an allergy or have a asthma, we will do that. Okay, we will do that. But this one tastes, it's good. I don't know if you go to the Korean restaurant, they have a Korean tofu, like a stool. Korean tofu stool, they use they use a little bit tiny of the dry fish. When you Korean, I tell you, Korean tofu stool, the secret, how can they make the soup so delicious? They are not using something like the chemical things, okay? Actually, they use 2 to 3 pieces radish, cook with the small fish, dry fish. Cook them first. They cook them like almost a half hour, and then throw them away, just to get to the water. You know, very funny, if it's dry small fish, if you just cook by themselves, it's a kind of smell. You will feel like it's a fish smell. But if you cook with the radish, that smell go away. Just like they cook with the lamb, same thing. So radish is a very good thing. So sometimes when you cook with the food, if they have a specific, we said the fish smell, or like a lamb have a certain smell also. Some people doesn't like it. But you cook with the radish, that special smell go away, but they will keep the nutrition. So that's very good. So I wish you would know that, okay? You know, this is a radish. Okay, this is, we make the radish with different kind of soup. For example, radish tomato soup, especially for general, you can use it for the whole family. Okay, we will see how to make it. Like for kids, it's very good for this. This is allergy season, or the kids sneezing, everything. After you make it, when you take it out, put a little bit of barley there, and then they will help for allergy, for cough, for sore throat, for the kids, okay? The radish with the lamb soup, you know, it's good for nutrition. Especially this time we want all patients have a good, the antibody, right? So if we want a patient have a good antibody, have a good, the protein, so lamb is a good thing. Why I choose that is because I know radish can cook with a different meat. For example, the radish can cook with the beef also, can cook with the pork ribs. In China, Chinese people like the radish with the pork ribs, okay, they chop it. All the meat, chicken, chicken, you can cook with that also. So we use the one way we discuss about the meat, how to make it. And then also the radish can cook with the fish, can make the fish soup. Fish is like the seafood, right? So radish also can cook with the seafood. They will also tell you what to do. So if you learn the one thing, so you can add, for example, today we're talking about is a fish, but this fish is very typical. This radish fish soup is special for the woman. After the labor, they want they want to bring up the milk, the milk for feed to the baby, okay? So that's why it's very special. This fish need to be the whole fish with the bone, with the all bone and then the everything there. So they will be good. But if you cook at home, you can put the fish meat. When you buy it, you can buy it from the supermarket, you can buy the fish meat. And then the same thing. That's why we want to know radish with the vegetable, and then with the meat and with the seafood. That's why we choose the different. And then let's see one by one, okay? All right, let's see this first.
今天我们用白萝卜和鸡蛋做的好吃的。首先我们将白萝卜去头去尾，将洗净的白萝卜削去外皮。白萝卜具有通气排毒的功效。现在特别是疫情时期，我们多吃点白萝卜，提高一下免疫力。将白萝卜切成薄片，再切成细丝。切好之后盛入碗中备用。再准备2个西红柿，打上十字花刀。倒入开水，给它泡软。再准备个小碗，打入2个鸡蛋。用筷子给它划散。再加入生冷水，继续搅拌均匀。放一旁备用。再准备几个香菇，切成薄片。料盛入碗中备用。锅中油热，下入蛋液，煎成蛋饼。煎好之后，我们用勺子给它分成小块。再盛入碗中备用。放软的西红柿撕去外皮。再分成2半，切去硬节。再改刀切成碎粒。锅热以后倒点食用油，下葱白炒出香味，再倒入西红柿，炒出汤汁，加入点食用盐，
too much meat because we want to keep
炒化以后再加入甜蜜
the
水，
tomato, okay?
再子大火煮开。
And then you just
煮开之后再下入白萝卜丝，
when they get boiled, and then put the radish,
煎好的鸡蛋也倒入里面，
and then put the egg. And then put the mushroom.
用勺子搅拌均匀，再加入点食用盐，扣盖转中火煮8分钟。 时间到了，我们给它开盖。哇，好香啊！
After boil, and then you put a little bit like a sesame oil.
我们再来点鸡精、小磨香油，翻拌均匀就可以出锅啦。
This is very simple, but it's very healthy.
撒上葱花，一道营养美味的软味汤就做好了。喜欢的朋友赶紧试试吧。
All right, this is like it's simple, right? It's simple. Let me explain a little bit. Okay, for the egg, you can just when they boil, and they just put the egg for the last step. But that egg not go to piece by piece. It's just like a soft. It's okay, all right? And the last step, if the patient, if anyone gets sneezing, sore throat, a little bit achy, like you just use the parsley. It's better than that, okay? And this one, if kids like, you can put a little bit, you know, like a potato. You can cut a potato just like the radish. And then you can cut a potato and then you cut the radish together. Cook, it's the same thing. So this one, I feel like when you use when you stir the tomato, not use a very hot oil, because vitamin C, I don't want to go away with the vitamin C. Just a little bit, like if you use the olive oil, a little bit warm olive oil, and then put the tomato in. Okay, we want the tomato in is because the oil can make a tomato get a little bit reddish. It's look good. They come up with a reddish, like a redness. So and then put the water. Sometimes I buy from the Whole Food, they have a chicken broth. You know, if you want to get more nutrition, you can use the chicken broth and then put it in and put a little bit. It's very good. My daughter liked it very much, and it's a simple way to do it. And then the all veggie can go in with that. Okay, all veggie. Only like the onion is not good with that. Onion is not good. You can put a different, another different things. And then all the green vegetable not go with that. If the all soup, you have like a tomato, all the green veggie will turn to the greenish the green will go away. They will turn to the yellow. So it looks not good. If you really want to put some broccoli, sometimes I want to put the broccoli. I don't cook there. I put the broccoli outside in the another the bowl to cook. When they get better, and then when they come out, I put it in when the last step. So you can see the broccoli is still very, very green, and then the tomato soup, it's red. It's good. Okay. So let's see. If you put a broccoli together to boil, 1 minute to 2 minutes, broccoli turn to very yellowish. Don't look good. Okay. taste is good, but it don't look good. We want to look good, okay? This is our cooking skill. All right, let's go to the second one. This is the lamb soup, okay?
先把羊肉用清水浸泡3个小时，每个小时换一次水。
The lamb, they want to put into the clean water and change the water every 2 hours or 3 times. They want this bloody thing to go away. So when you cook the soup, it will be very clean.
切香菜。
And this is the body.
干辣椒切断。
This is red.
炒火拍松。锅中倒入羊肉，加入适量的清水。
You use the water to boil.
水开后继续煮5分钟左右。
5 minutes. Cook for 5 minutes.
把羊肉打出，清洗干净。
Yeah, and then you take it out.
锅中倒入油，
Wash, very clean.
放入蒜头、姜片、干辣椒，翻炒。
I want to say a little bit. The lamb, a lot of people doesn't like they make soup because it smells. Sometimes it's strong. Okay. So when you want to make a soup, really taste good, but not that strong smell with the meat. The way they do is they put into the cold water and then put the ginger there, okay? For 3 times to change the water. So that way the all like a bloody, the blood things, they're coming out. Don't put the hot water, okay? Cold water. When they in the cold water, all the blood coming out from the meat. So they can take away a lot of blood. For 3 times, and then you dry it a little bit. And then you clean the meat very well, and then they do that. But some people do like the smell with this meat. They want very strong lamb smell. So you don't need to wash this way. Like me, I never take meat. So when they cook the smell, I cannot do it. But everyone differently. Okay, if you really like the smell, you don't need to wash for 3 times. But someone, if you do like care about, I don't want that too much smell, you clean the water, and then you in the boiling water do 1 more times, get all the dirty things go away and clean it, and then this meat is very, very clean. When the soup coming out, it's very clear, very, very good. Okay, and then
香味。
they put the on like a
倒入羊肉，
and then they put the meat,
把羊肉炒出香味。
and then they stir in the oil.
把炒好的羊肉倒入砂锅，
And then when you stir it and then put it into
放入小茴香、陈皮、
this is
草果、当归。
what do we see? We saw them put the ginger and then dangui. Dangui is the herbs because dangui lamb soup is special for women to build up the energy and blood, and then for help to nourish the blood. 当归羊肉汤 actually it's a very famous like nutrition dishes. Okay, 当归 is herbs, and then they put into together to cook them together. Okay.
放入适量的酱油、白酒，加入盐。
This is like a wine. This is not red wine. Chinese wine is made by the rice. Do you know when you go to the Japanese restaurant, you will have a sake. It's a kind of like a sake. They made it from the rice. This is what they put, okay? I really don't know. American usually use the red wine. You can use maybe American, maybe you can use the white wine also, right? But this will make the soup. We use a kind of like a sake. It's not like a American wine, but I didn't try if I can make the American like a white wine or not. I didn't try it. Maybe I will try it to tell you later.
倒入适量的清水，
And then put the water.
盖上盖子，开火，小火慢炖。
And then they use the small.
水开后继续炖40分钟左右。
Make it to boil and then simplify.
时间到，开盖，放入白萝卜，
And then put the radish.
翻搅均匀，盖上盖子，继续炖20分钟左右。
And then another 20 minutes, okay? When you cook the lamb meat, around 40 minutes. And then you put the radish in, cook another 20 minutes again, okay?
时间到，开盖，加入葱花、香菜，羊肉汤就做好了。
And parsley. This is they put the parsley, okay? All right. This one, it's very. It's I tried a different way to see. This one, for example, if you want to use the chicken, also can do it. Same way, you chop the chicken better with the bone, okay? You can chop the chicken like the leg area with the bones better. Only meat doesn't taste good this way. This soup, when they make, it's coming up a very, like it's a white, and then it's like a milk, very good. Okay, so if you want to use the chicken or use the lamb chop, or you want to use some the oxtail bone also can make it also. You chop it same way. You clean in the water very well, okay, and you boil with the boiling water. After boiling water, cook with them like 5 minutes, and then you have to slow away all the things because they have a lot of dirty things still coming out. Where they come up, this is because the old blood coming out. The old blood, when they cook, if you don't clean them very well, they turn to the darkness on the top. So the soup don't look very well. That's why you have to clean that. When you really clean away, and then you make the soup, look at that. They are very clean. And then they turn to the white, like the milk. It's good, okay. Okay, so you can do the same way. You can put the chicken, you can, whatever you want to do with the milk, it's a meat. It's the same way to do. And then let's see the fish, okay. Fish, I want to see two kinds. Why? Because a lot of people doesn't want to see the fish be cooked. Like my daughter, she doesn't like it. So whatever I cook it this way because I have to slow away everything. So I show you different. This one, because you can still eat the meat, but fish will be there in the soup. And this one, fish is not there because they put it into the special bag and then they throw them away. Two kinds, we can always do the same thing, okay? English, good. This way, all right? Okay, if you okay, uh-oh. All right, so this is the dishes. They have all recipe there. Okay, let's see what this is. This is a very lower, high protein, lower like the cholesterol, very lower fat. Okay, so actually this is a very special dishes we recommend for the people they are doing the weight control also, because they want to get a good weight, but they don't want to like have no protein, so we do that. Okay, and then also this dish is very famous after recovering from some disease. After, for example, like after surgery, we want the scar getting better, because this one heal very well. Radish, it will help you, you know, because during the operation, you know, the first thing after the operation, doctor will say, oh, did you got your bowel movement to move? Did you pass your gas? If you say no, they will think, oh, your recovery not started yet. So this is the dishes, give you the protein, but help you move the bowel, and then move the gas. Okay, so that's why after the labor, first thing they drink that, and then they try to give you enough protein to bring the milk back. and then also will help you pass the, if you after cesarean, and then you can pass the bowel movement and pass the gas. Okay, but in America, a lot of people doesn't like to see this kind of fish, like with the skin, with the head, with the bone. But for nutrition-wise, we want this bone, everything could be together. For example, like I go to the, I went to the fish market in the South Pole, something like. They have a lot of like a salmon fish head. So you can buy the one head or something, cook the way like this second, which we can recommend now. You cook it this way and then get all the nutrition, okay? The nutrition from the bone is very different from just from the meat. For example, if you feel like lose the bone, you want to get in the like a bone density getting stronger, okay? Not only for calcium, okay? Calcium, sometimes you cannot say, I drink a lot of calcium, I eat a lot of calcium, but doesn't my bone still weak? You know why? Because they are not the alive like nutrition there. But fish is the live nutrition. Included also is the like the oxtail bone or something. They can help the bone getting strong. So you can use this way to cook for your family. Sometimes I put this one, add a little bit tailbone together. Anyway, they put it into the little bag, and then you can get the all like a bone density there. So, cook it together can help you get your skeleton getting bigger. And then also, some parents ask me, Dr. Jing, is there any herb can help my kids growing fast? I want them can getting like a higher. Okay. I think the herb not as good as you eat the food, because herb the kids doesn't like it. The taste not good. Number one. Number two, bone density. You want to get the strong bone density, actually, like the fish bone and the chicken bone, and then even the cow or with the bone skeleton is better to cook them together. That's why I will recommend you take a look. Just ideally, you know how to make this kind of soup. Okay.
清佢同埋啲血水洗乾淨佢，同埋個腮咧，如果佢未清潔乾淨咧，你就要掹埋出嚟啦。嗱，鯽魚咧係好有營養價值嘅一種魚嚟嘅喎，特別咧適合產婦啦，生完 BB 冇乜奶水嗰啲咧，煲嚟飲咧就可以增加奶水添喎。仲有特別適合老人家咧，同埋病後虛弱嘅朋友食用嘅。咁產婦如果煲鯽魚湯，咁可以唔煲白蘿蔔啦，因為白蘿蔔少少寒涼啦，始終都係。咁可以落木瓜都好好飲嘅喎。嗱，鯽魚咧有健脾開胃啦、去水腫啦、活血通經絡、溫中下氣，對脾胃虛弱啊、氣管炎啊、哮喘、糖尿病嘅朋友飲啦，就有好好嘅功效㗎。嗱，鯽魚咧裡面咧含有非常優質嘅蛋白質喎，容易吸收、易消化啦。經常飲用或者食用咧，可以增強抵抗力嘅。咁1星期飲2次都好足夠噶啦。嗱，睇翻畫面，我哋燒熱咗個油之後咧，就可以擺片薑落去煎條魚噶啦，煎到兩面金黃色啦，就可以灒啲滾水落去噶啦。嗱，煎魚嘅時間咧，我又講下白蘿蔔有咩功效同有咩好處啦。嗱，白蘿蔔咧係一種好低熱量嘅蔬菜嚟嘅，每一磅嘅白蘿蔔咧嘅熱量咧淨係得100卡路里嘅啫喎。嗱，白蘿蔔咧裡面含有豐富嘅維生素 B1、B2 同埋維生素 C 嘅。嗱，白蘿蔔裡面嘅粗纖維咧就可以促進腸道消化啦，同埋增強免疫力嘅。佢仲有清熱解毒嘅。
this is tricky. If you want to make a good soup, okay, the first things they put the ginger cook it together is for what? To get the smell with the fish smell, because they with the ginger to burn to do it, can get the smell. And then you need to put the boiling water. Only boiling water. If only you put the boiling water, you can make this soup like the milk, like a milk, white, very white. The milk coming like a spoon, soup come out like a milk, very, very delicious and look good. If you put the cold water, the protein getting cold, and then it cannot go turn to the white anymore. Okay, so this is
治療嘅功效啦。嗱，中醫學嚟講咧，白蘿蔔咧，佢係可以幫助化氣啊，排走體內裡面嗰啲濁氣、唔好嘅氣體，排晒出嚟。中醫就話啦，生吃咧就可以升氣，熟食呢個白蘿蔔咧就可以下氣嘅。咩叫升氣同下氣咧？嗱，升氣咧即係向上升啦啲氣，咁咧生食咧就可以升氣啦。生食
Okay, this radish they put a little bit salt outside, and then after like 5-10 minutes they will come out with the water. So they slow away the water just to use the radish. You know why? Because these dishes they put a lot of radish. If you have too much radish, they will come. The soup will come with the radish smell. So they don't want too much radish smell. They want the fish smell. Okay. So they take away the first water, throw them away, and then they cook with the fish again.
咧就容易打絲液咁啊，走咗啲氣出嚟啦。咁如果你熟食咧，就下氣啊嘛，下氣咧即係容易放屁啦。嗱，咁因為咧佢有化氣嘅功效啊嘛，所以咧如果你食咗人參咧補氣咧，你就千祈之後唔好食呢個白蘿蔔啦。咁你食人參想補氣啊嘛，但係咧白蘿蔔就化氣啊嘛，咁咪減低咗人參補。
They only keep the soup and then use this one, put it into the bag to recook.
氣嘅功效咯。嗱，有時聽人講咧就話啦，紅蘿蔔咧唔可以同白蘿蔔一齊煮嘅喎，咁點解咧？咁咧原來咧係因為紅蘿蔔裡面有一種酵素咧叫解酵素啊，佢會破壞。
In this bag, sometimes, for example, if I make for the like after labor woman, and I will put a little bit zucchini there because zucchini will make milk out. Okay. If I cook for the people after the surgery, I will put a lily there. Lily will help the scalp heal well. Okay. And then if I cook for the people after, like for example, like a cancer patient, after chemotherapy, and then she feels so dry. Chemotherapy and radiation, she feels so dry and then feel like no energy. And then for the bag, I put a little bit ginger, like American ginger. I put a little bit cooked together. So this is the place we cook. And then we also have people like after labor, lose a lot of blood. And then, you know, because lost a lot of blood, okay? And then she feels like the pale and then feel very, very weak after the labor. And then in this time, we put, in this bag, I put a little bit of dangui, we put a little bit of huangqi, and then the dates together, okay? But we make sure that herbs, you put it in, not make this soup getting dark. If they're getting dark, it's not good. For example, I won't put a honghua, red flour. I don't put, because if I put that, they turn to very red. So this soup is not look good. So this is how, the nutrition diet. It's not only the nutrition good, looks good, taste good, serve should be good too. And then people will get the And usually we have a restaurant, a special make for that. I tell you, when I come to America, I try to make it. So, and then finally I cannot get the license for that because they said that we don't know what's that. I don't know which department should give you a license.
如果白蘿蔔嘅維他命 C 如果一齊煮的話，咁一齊煮咧就唔會話產生啲咩毒素啊嗰啲嘅，但係咧就會減低咗白蘿蔔嘅維生素 C、維他命 C 嘅功效咯。好啦，咁介紹完鯽魚同埋白蘿蔔嘅功效咧，我哋又講下花椒粒有咩用喎？花椒粒咧加幾粒落去咧係有驅寒嘅作用嘅。嗱，因為咧我屋企
This is lemon leaf, fresh one. I used to have very good lemon tree. So this is a fresh lemon. If you really cannot get the lemon leaf, you just get a piece of the orange skin. Same.
到小朋友啊，同埋咧呢個湯我煲埋俾婆婆飲啊，所以咧我就將啲魚咧隔咗渣佢咯。如果你哋咧唔係話特別俾小朋友或者老人家飲咧，你就可以連啲魚肉咧都可以食埋㗎喎，因為咧我係驚老人家啃親骨。
Someone don't like eat the scallion, and then you can rub it, put it to cook. When you want to eat, take them away. Okay, that's why they do this.
所以我就將佢入咗落魚袋咯，同埋隔晒渣佢咯。咁如果你中意食葱咧，就唔需要好似我咁樣紮住啲葱啊，因為我啲小朋友咧唔中意咁樣煲完湯食嗰啲葱啊，所以咧我就紮起佢，咁方便一間夾翻起啦。咁其實如果你唔想咁多功夫將呢個白蘿蔔切粒咧，你可以切片或者切條都 OK 嘅。咁我就都係方便老人家同埋小朋友食啦，所以我就切細粒啲，同埋隔咗啲魚骨嘅今次。嗱，其實咧鯽魚啲魚肉咧食埋咧就更加有。
Like the fish, like a fish's bone, everything. So if you make it for the kids, you better use this way. If you make it for the senior, you better do this way so they don't get trouble. Otherwise, you'll get trouble, right?
㗎啦，所以可以喺魚袋嗰度咧倒翻啲魚肉出嚟食，但係小心啲骨啦。希望你哋中意我今日嘅分享，白蘿。
Good, right? All right. So I think I share with you is a different way we make this radish. Of course, so many different things, right? I usually always recommend you at home. Okay, this is the radish. We can use a different way, but radish in this particular time, and then you know it's more effective at home. So that's why we recommend that. And then later on, for the different issue, let's say talking about menopause, and then I will try to recommend 1 or 2 dishes for different things. Okay, like Dr. Fang, if they talking about the pain management, and then she may recommend some like a bone, some good dishes for bone density also. Okay, so I think alternative medicine, that means not only this kind of medicine, not only give you the needles, give you the terrible taste tea, actually try to make your life getting cheerful. Okay, also should be cheerful, right? All right, we share with that, and then I want to give you the information. Some patients ask me, mail me, say, you said that there was a 4 kind of herb, what do they do? And they give me a little bit brief information. So I try to give a little bit information about this 4 special products we use in this COVID-19 special care time. Okay, the number 1 is the immune scan enhanced one. In this one, the major one, this one is especially try to build up your body's immune energy. Okay, for example, reishi, huangqi is special for prevent, to make your whole body's like immune system get alert, and then to watch on it and work hard, and then fight with whatever the infection. Okay, and then also there was another one also can be work for specific, like a Balangan. It's a specific work for the when you have a viral attack, you have a sore throat, you have a pain or feverish, and then you have a upper respiratory symptom, sore throat, like a cough, and a Balangan work for that. And then special, they also work for your sinus also, okay. And then I want to recommend the RuoyiFang. RuoyiFang, it's a special, the smell, xiang in Chinese words is smell good. It's like a frequency. RuoyiFang is a kind of herb frequency, usually when you go to the mountain, okay, all the the fogs or something around you. So RuoyiFang is a kind of like a herb. It's the herb smell, okay. For example, like a tea tree, that smell, it's very strong, okay. We cannot say it's like a give you open your chest or something. But RuoyiFang, if you smell it, it's especially open your chest and your digestive system. That's why we always use when the people have a infection, like a stomach getting nausea, vomiting. This is the symptom. And this time, COVID-19, they have a problem with they cannot smell. Say the smell get changed. That's why I want the RuoyiFang to open. Because if the leaves have a special smell, look like smell good, and then they will open the nose, like make the nose, the nerve around the nose can attract this kind of nerve. That's why we use RuoyiFang also, okay? So Senjang is a ginger, okay? It's something like that. So this formula, especially we will use for the people say, oh, I'm home, I want to make myself stronger. Or when the time comes, I have to go to the work and I don't have any symptom. I just want to make my immune system get stronger, and my digestive system, and then my throat and the nose can be have a weapon to prevent you get the a viral attack through the nose, through the mouth, right? So this is the herb we can use for that. They try to work for your throat, and then try to work for your nose also. That's why. So this is for prevention use, okay? Beside if the patient wanted to use them, that's why we use that one very early beginning. It's the patient to use that once in the very severe infection time in the New York, we ask them use twice a day. Now for prevention, and then they use once a day already. Okay, but anyway, I want to explain to you why we have this formula for what. Second formula, it's called the Fluax. Okay, it's it's for ease all symptom with the flu. Actually, this one is not only this time we use for COVID time. Actually, we're using for like a regular flu time, over in the past almost 20-some years we use that. Okay. Because when you get flu, several symptoms, no matter what kind of viral, because we cannot say herb fighting with a specific antibiotic. We know which kind of virus and then which kind of bacteria, and this antibiotic work with this bacteria. It's not like that. Herb work for that. It's ease the symptom to help the immune system. That's why each year the flu changes, but symptom almost similar. Sore throat, sneezing, feverish, okay, and achy. They're almost similar, okay? And then cough. This kind of symptom, they're always there. That's the flu X we use, okay? They can ease the symptom, okay? They control the symptom or help you, like help the symptom for the feverish, headache, nasal, congestion, cough, you know, either by flu or cold. They try to make your body to work for that, okay? That's why. So we are not claim say that herb can antiviral. We cannot say that. But when you have a flu, when you have a cold, even when you have a COVID, okay, during this time, if you have a certain symptom, I think use that can ease the symptom. Okay, let's say this way. So that's why we also this time will use that also. Okay. Okay, this is the one special we use for the cough. Okay, this one not only this time we use, also this is for cough, just like I said, cough caused by the different reason. Okay, cough in our office, we divide the 3 parts. One is caused by the infection. One is caused by the allergy. One is like a later stage of the cough. Okay, if cough caused by the infection, you need to take away, you need to deal with the infection. What's the infection? Like the mucus, you can see the mucus heavy, like sticky, yellowish, or the greenish sometimes. For example, sinus infection also could cause the cough. When you have this kind of cough, and the mucus also come up with a greenish or the yellowish. So whatever you have a cough, this is the kind of herb we use for clear out the mucus, and then take away all the infection caused your lung not clear. That's the herb can do that. Okay. Cough also could come from the allergy. This is like a hay fever, also will cause the cough. So this one not for hay fever, not for allergy. This one is we special made for you have like a infection. Infection, this cough caused by the infection. I want you to know that. Okay, this is, but we have some herb there also can be used for now. I always tell patients, the patient say, I use the antibiotic, I use a lot of herb, the medicine. Why my cough is still there when it goes to the later stage of the cough? Why? Because the antibiotic work in your body, fight with your bacteria, fight with your viral, whatever it is. And then the bacteria or the viral, they stick on, because they fight with them, they kill them, they stick on your airway, okay? And then later stage, you're not in very bad like infection, okay? But your airway is very sensitive when you're breathing because they lose the flexibility. Our like bronchial should be flexibility, open, you know, okay, when the breathing, they can get the flexibility. When you lose the flexibility, all the air go in and out, they getting uncomfortable. They try to cough. So in this kind of cough, you need to add a little bit herbs to help the bronchial getting a little bit soft. Just like when you get very tight there, a little bit of water, milk, a little bit of milk, a little bit of water, and then we call the ing. We call this kind of cough is ing deficiency. If you can make your ing a little bit better, and then you get a little bit soft. So the bronchial can open again, can move again. So they're easy to get the mucus out. So the cough for this time, you need help the mucus out. This is what we do. A lot of COVID patients, if they have a mucus, the first thing is their bacteria or their infection not get controlled. The second is the mucus cannot coming out. Okay, so we need the bronchial move well, and we need the mucus to get out. That's why we want this kind of patient can use this kind of like the herb tea to help that. Okay. Okay. Let's talk about this one. This one, it's from Wuhan formula. It's particular. Before we don't use that. Wuhan formula is a little bit. They tried different herbs to see which one can particularly work for this kind of like a lung infection, and then I think from the 14 or 16 herb, I forgot. They try to test and then see which one. I'm not talking about like a lab test. They use the clinical trial to see which one can work better to get the lung clear better. So they give the formula. So this formula actually it's from China. Okay, only used for the patient that they do have COVID-19, that kind of cough. So that's why we use this one. Okay, so particular use for this time. So we don't need to recommend all the patients to use them. But anyway, when a lot of patients email me say, Dr. G, explain to this herb why it works. So I will try to spend this time to share with you what this herb do and what we try to do the best to make the easy way. Usually when you get on the online, I always prescribe like the customized the formula for you. But sometimes they just order, say, oh, I want something for our family to use for general, like, okay. So we just give them, you know, the information, say you can choose the one. Especially not now, especially like 2 months ago, when New York getting so seriously and everything so quick, I don't even have enough time to see all the patients. So we just let them know this is the herb we can use, give it to you. And then now I share with you why maybe you take the number 1, number 2, number 3. I share with you what kind of herb you maybe take and then what kind of herbs, what's the function for that. Okay, that's it for today with me. And then I think Dr. Ling will give us some information again.
Actually, today's Dr. Fang to share.
Dr. Fang or Dr. Ling? Dr. Fang.
Dr. Fang.
Sorry, Dr. Fang.
Hi everyone. Hi. Oh, it's on already. Oh, thank you for Dr. Jin share all these useful like diet information with us. So I believe everyone like somehow tried a little bit during the weekend. So now we have new recipes. So hope we can like try this new dish out with our families. So today I want to discuss a little bit about the PPE, the personal protective equipment with us, because with more states and cities planning reopening, also like with all these nice weathers during the weekend, send all of people to parks enjoying sunshine after weeks we stuck at home. So how can we protect us from coronavirus if we go out? Besides of the social distancing, a mask, gloves, goggles necessary for us. So first, it has shown the coronavirus caused airborne disease carried by droplets from person to person. A single cough can produce up to 3,000 droplets. There are also studies showing it can be spread simply through speaking. So once it's out of our mouths, many of the large droplets will quickly settle onto nearby surfaces, while the small ones remain suspending in the air for hours, so where they can be breathed in. So however, the behavior of the virus-filled droplets in rooms with air conditioning and outside environment less well understood. They are thought to settle on surfaces more quickly in disturbed air. There are some other reports that coronavirus can spread through ventilation symptoms in the building also. But the more important is now we have increasing understanding the role of asymptomatic spreader playing in our outbreaks. So wear a mask is not only like filter out the large particles in the air, protect the wearers like the nose, mouth from contact with the droplets, splashes, and sprays that may contain pathogens. It also protects others by reducing exposure to saliva respiratory secretions of the mask wearer. So coronavirus is thought to mainly spread through the droplets, but protein from our eyes and even tears can also transit the virus. The latest CDC guidelines are in and are directionally clearly say, keep your hands away from your eyes. People could get COVID-19 by touching a surface or object has the virus on it, like a door handle or table, and then touching their mouths, noses, or eyes. So you're mostly likely to inhale these droplets through your mouth, your noses, but you can also enter, it also can enter through your eyes. Until now, there's no evidence suggesting contact lenses wearers are at like higher risk for becoming infected with COVID-19 than eyeglass wearers. So if you're not sick, you can wear either contact lenses or glasses. But no matter in which situation, people should always wash their hands and dry them before touching any parts of your face. So the last part is when the gloves are needed. So wearing glove outside of the instances, like for example, if you go to supermarket using the shopping cart or using ATM, is not necessary to protect you from getting COVID-19 and may still lead to spread germs. So the best way to protect yourself from the germs from the running errands and after going out is regularly wash your hands with soap and water for 20 seconds or use the hand sanitizer with at least 60% of alcohol. So CDC not recommended the use of gloves for the generally daily activities. There are a few exemptions such as touching the buttons or handles on the gas pumping when disinfecting wipes are not available, cleaning and disinfecting the surfaces, also handling dirty laundries, kitchen items, or trash from someone who has the virus. So this is like we daily can use like if we want to go out or protect yourself at home. So this is all I want to share with you like today. So of course we all want to restart our normal life, but we're not going to restart until we have harder evidence that we've turned the corner. Thank you everyone, yeah.
Thank you, Dr. Fang. So does everybody have any questions?
Yeah, I saw some patient ask very much about the cooking way or something. Whatever you want to share with you want to ask, and we can share.
I have a question, Dr. Jin.
Okay.
The radish, the white radish.
Yes.
Is the taste similar to the red skin radish?
No.
Oh no.
No.
It's
different.
Spicy, no?
Red skin one a little bit more spicy, a little bit more spicy.
Because I eat radishes all the time. I love them.
Yeah, but
yeah.
Okay, you know, and then also when you make the soup, red skin one, if you get the skin out, it's okay, super still white. If you make it with the skin, the color turns to a little bit red. It's I think a white color is better.
Okay. Okay.
Yeah, but function is similar.
Okay.
It's similar. Yeah.
Thank you.
You're welcome. And the white radish is a little bit juicy, more juice.
Oh, it's juicy. Okay.
Yeah, it's more juice. Yeah.
I'm thinking you have to have a dinner party.
Yeah, well, I was thinking about that when we teach at least several dishes, and then we hope we will have a party for house cooking dishes party together.
That would be great.
And then we can be, yeah, I think it's a fun.
That would be fun.
Yeah, yeah. That would be fun. Oh.
The last one, and I missed the first one of your,
Yeah.
you know, conferences here. And I missed the last one because I didn't sign up in time. I'm like, oh God, I didn't realize. Oh, stupid. And the first one, the same thing. I'm terrible with this. I'm terrible with all these techniques.
But we have a recording there. We recorded all
Yeah,
things.
we have sent the YouTube link via email.
We have the link.
How do I find those recordings? How do I find what the...
You can find from the email we sent to you.
Yes.
I attached all the links for
you
last
did.
3 times.
Wonderful,
Yeah,
wonderful.
we all link each time.
Okay.
So,
thank you for pointing that out, because otherwise I wouldn't be able to figure it out, you know?
don't worry. Because anyway, we send it to the patient when the patient, they cannot come. But I'm appreciate you are here with us, and at least we will know, oh, he's you and you.
No, it's wonderful. I told my husband, I said, oh, no. I have tonight, I have Dr. Ming, I have to watch this, so forget, you know, but wonderful. And so the Fluex, I just wanted to ask you, because I was taking the Fluex, but then I had asked you to add a little something more for the lungs. So what you're saying is that you personalized that for me. That wasn't necessarily.
Yeah. Your is I prescribe.
Yes.
I put this herbs add on. You know. I know you before.
Yes.
You always, have the issue I know. So that's why I add on. I have a computer here.
Yeah, because, I was thinking when you were talking about the one with the fragrance, because you put in this second one, and it was so fragrant. And I thought, oh my heavens, what is this additional thing in there? It was almost like incense, beautiful, because it is a strong tea. But the second one that you said was just lovely. It had this extra lovely.
There, yeah.
Yes, beautiful, beautiful.
Anyway. Also have essential oil.
Maybe that was it that you put that
when
in there.
they give the spray, I put it into the essential oil.
Because it was incredible. I have to get more of that. I have to call. Plus the smoke. Plus
not as critical time like 2 months ago or 1
yeah
ago.
I was
so we want the patient to still aware.
Yeah.
It still has to be. Today I read all the report for the recovering patient. Okay, so I still feel like I'm a very preparing person for the patient. I'm a worry. If I worry, you worry. If I'm not worried, you're not worried. If I think recovering in the first stage now is so important, that means it will really very important. That's why we spend so many time and I try to make a bigger effort to tell all the patients if it's the recovering time, you need to do something. Number one. Number two, now it's not the time we should be like take it easy. I don't care. Because some patients say, anyway, we don't know what is the latest. Maybe one day we come to the work, everyone will have it. So what? No. To me, I feel like if one day we have to face that. So now is the time to try to make yourself be good.
Yeah.
That's what I'm saying. That's what I'm thinking. So even I don't know myself, because I'm our office person, maybe in the front, have to face to be the situation. but I want our patient, at least, you don't have to. For us, maybe we have to.
Yeah.
The doctor, it's a kind of responsibility. That's what I'm saying.
Mhm.
When you need to face to it, you have to face to it. But now, if we don't have to, we try the best to make ourselves getting stronger. We are home now for 1 month, 2 months. In these 2 months, at least we can do something, make ourselves as much as we can do, be stronger. When we have to face to the all public, how can we do? We have to face to the patient, right? So try to appreciate the time which we have now. Don't be angry, don't be depressed, don't be like complain, say, oh, I have nothing to do. No, maybe this is a life who want us to look at ourselves, give ourselves the time, take care of ourselves. And then maybe it's a time give to our all staff to sit down to gathering all the information, at least to have enough time to tell our patient.
Mhm.
That's why we make this record, send it to the patient, even they are not have a time, but we give the all link to them. So we try to show like we care. That's how we care.
Yeah.
So we wish our all patients be healthy and stronger. I'm glad that some patients, they are not get this problem. I'm also try to let the patient which they do have this problem also getting stronger, and with our all care, mentally care, and then physically care to help you to get to recover. That's what I'm saying. I wish you all good. Okay.
Thank you so much for these, Doctor. Thank you. These have been wonderful. I'm gonna.
So we have a full session for COVID, and then later on we will give the different. We do little by little. You will see our session will go more and more until or even they opened. We still can have that. We can do slowly because when we're busy, when we open the office, we're really busy. All the staff come here, come office like 8:30, go home like 9. So we don't have a chance. Sometimes we're busy. You come here, I really don't have a time to sit down with you to talk. I'm so happy. At least we have time.
This is such a treat for us, Dr. Jin. You have no idea.
I hope you know this is we get the chance to can sit down together and talk, and then but I think when we open it, we can still set up the session. I think Zoom is good. If we set up the one section, all the patients concerned about this kind of things or interest about this, we be together to listen or we can discuss together.
Yeah, it's a wonderful idea. Wonderful. And it's very reassuring.
See, for the all software, whatever the technique, I don't know about that. In the first time, I'm so stressed out. I said to my daughter, I don't know how to do that. I said, oh, Mom, it's easy, you can do. Now this time, I'm getting easier a little bit. Little by little, we get to relax. So happy, can be sit this way, talk to you, and then we don't need travel, and then, it's good.
Very good. Very good.
Every patient. I saw the different patients, but it's good to see you all. And then the one patient said, if your temperature always low, is there any food that can make you high up? Lamb, dangui, and the lamb soup. It's a particular soup to make you get a more young energy. Okay, more young energy. Just this specific, all the doctors know that, right? Hungry, and then the lamb soup is always to treat the people that their temperature is so low. If you always feel heat, maybe you try to different. Maybe use the chicken meat or the duck or the fish. Okay.
Interesting.
Okay. Thank you, everybody. Thank you. So from next week, we'll have a new topic.
In 2 weeks, I think.
Everybody can see now. Yeah. And also I have sent the register link in the chatting screen. Also, we will send email to everybody, and you can register. And yeah.
Thank you for that, Catherine. I reviewed them. They're very helpful when we go back and look. And Dr. Jin, I made some of the tea from last week.
Oh, good.
Yep. I made some of them. Delicious. Yes.
Usually, if you're busy, you don't have a time to try. If you're
I did. I didn't do the one yet with the garlic, the garlic, the ginger, and the orange or the lemon. That's next. I'm going to do that one.
Yeah. Good.
Very soothing. Very delicious.
Good. Let's try. I will, because I'm a person, especially in China. I'm a person, particularly not too many people trained for this herb, like cooking, like a herb food cooking. But I'm working on that for many years. So I think
very interesting.
This is my specialty also. Even in America, I cannot do the restaurant, but I try to make a patient will know actually we are all our own doctors. If we can make a
That's right.
And they can help our family. You don't need me. We said, oh, eat one apple, keep a doctor away. I said, if you know not only apple, if you know the some fish, it's even better, right?
Yeah.
Okay, good.
Okay. Thank you, guys. Thank you.
Thank you so much.
Thank you.
Thank you.
Good night.